Imagine taking a new drug to fight arthritis, only to unknowingly awaken a hidden danger in your body. What happens when your treatment turns against you? Stay tuned to uncover this medical mystery. Hey curious minds, welcome back to our channel. If you are new here, we spotlight the most unusual and fascinating medical cases to raise awareness and spark curiosity about health and diseases. Today, we're exploring the gripping case of an 80-year-old man whose journey with rheumatoid arthritis took an unexpected and dangerous turn. From battling joint pain to facing a life-threatening infection, this story has it all. Alright, let's get started. Meet our patient, an active 80-year-old French gentleman diagnosed with erosive rheumatoid arthritis, or RA, a type of arthritis that not only causes joint pain but also causes joint damage. After 3 years of increasing discomfort, he began treatment with methotrexate and corticosteroids. These are common medications used to reduce inflammation and slow disease progression. However, despite these treatments, his rheumatoid arthritis did not improve significantly. In order to tackle this stubborn RA, his doctors decided to add another drug called adalimumab, a TNF inhibitor. TNF inhibitors are powerful drugs that target specific parts of the immune system to help reduce inflammation. But here's where things started to take a turn. While TNF inhibitors like adalimumab can be incredibly effective for RA, they can also suppress the immune system, which can increase the risk of infections. It's a delicate balance between managing autoimmune conditions and maintaining immune defense. Time for quick poll. Have you or someone you know ever taken a medicine that has affected immune system? Let us know in the comments below. Let's go back to the case. Now, 2 weeks after starting adalimumab, our patient began experiencing a productive cough. At first, it seemed like a common cold or maybe some pneumonia. But over the next 8 months, his symptoms started to get worse significantly. He developed severe difficulty breathing, fatigue, night sweats, and lost about 18 pounds of weight, and had intermittent fevers as well. His doctors ordered some lab, and some of them came back abnormal. For example, his lab called C-reactive protein and ESR were both extremely high. Now that can indicate inflammation. He also had elevated white blood cell count, another marker of some sort of infection or inflammation. He also underwent some imaging scans that showed bilateral pulmonary nodules, which means masses in the lungs on both sides. He also had pleural effusion, which means there was fluid around his lungs, and there were some enlarged lymph nodes in the center of the chest. Initially, infectious workup was started, including for common bacteria and viruses, but those were all negative. Now the doctor started to dig deeper and ordered some fungal labs and TB. Initially, his TB tests were negative, but they ran some special tests and that came back positive with multi-drug resistant tuberculosis, or MDR-TB. Alright, time for a pop quiz. What does MDR-TB stand for? A. Moderate disease, B. Multi-drug resistant TB, or C. Mildly dangerous TB? Put your answers in the comments below. Did you know that MDR-TB is resistant to at least 2 of the most potent TB drugs? According to the World Health Organization, MDR-TB is a significant public health issue, making it harder to treat and control. Once diagnosed, our patient was put on a 18-month treatment plan based on guidelines for MDR-TB. This included a combination of antibiotics like moxifloxacin, linezolid, ethambutol, and so on. Importantly, his RA medications, methotrexate and adalimumab, were both discontinued to allow for his immune system to recover. Thankfully, within weeks of starting the anti-tubercular treatment, his symptoms started to improve, and 5 months later, he was feeling significantly better. He had gained his weight, he has gained his strength back, and was doing his normal daily activities and travels. Now let's look at some data. Did you know that almost 5% of patients on TNF inhibitors may develop latent TB reactivation? This chart shows that patients on TNF inhibitors have a significantly higher risk of TB reactivation compared to the general population. Typically, patients starting TNF inhibitors get tested for latent TB infection. However, sometimes this can be overlooked, leading to a case like ours. Alright, before we wrap up, here are 3 resources if you want to learn more about this topic. One is the website from CDC, or Centers for Disease Control and Prevention. Another useful resource is Arthritis Foundation, where you can learn more about rheumatoid arthritis in detail. And then finally, WHO, or World Health Organization. They have a page where they talk about multi-drug resistant TB. Check them out for more detailed information. In summary, this case highlights the delicate balance in treating autoimmune conditions like rheumatoid arthritis with powerful immune suppressing medications. Now, while these treatments can be extremely effective and improve quality of life, they can also carry risk of infections such as TB reactivation, especially dangerous infections such as MDR-TB. We hope that you found this story eye-opening. Don't forget to hit the subscribe button so you don't miss an update from us. Thank you for watching, and we'll see you in our next video where we uncover a strange case of diabetic foot. Until next time, stay curious and stay healthy.